Okay, we are live. We are live on the As One Foundation Facebook page. So I will just go there so that I can monitor for questions and comments. As I say, hello, world. I am Dr. Tamia Austin, Executive Director of the As One Foundation, where our mission is to empower families globally, delivering life-saving sickle cell education. This mission is as a result of a tragedy turned triumph story of Devard Darling. He is an identical twin born in Nassau, Bahamas, uh, and much to the surprise of the parents and the doctors who were not expecting twins, as throughout the entire pregnancy, they had been hearing two hearts beating as one, only to learn and see and witness Devon follow Devard out of that birth canal that day. These young boys would end up moving with their parents to Houston, Texas as youngsters and matriculate through Houston area, Fort Bend Independent School District, middle and high school, achieve academically and athletically, and were recruited nationally and ultimately decided to go to Florida State, one a defensive player, one an offensive player. They played as true freshmen. And as customary, they learned of their sickle cell status, their sickle cell trait status as freshmen, needing to complete the pre-participation physical. They were advised that sickle cell trait was nothing to worry about. You'll live a normal life. They were only warned that procreating with someone else with trait, gives you a 25% chance of birthing a child with disease. And they were sent on their way. They played as true freshmen, almost won the national championship that year, one game shy of a perfect season. So they ended the season, the spring of 2001, and returned in the off season more motivated than ever. They had gotten that close to winning, so they were out to prove they could go hard, they could push through, they were winners. And in February of 2001, they were going through mat drills. And these are infamous for dehydrations, protein spills, also known as throwing up, working so hard that your body stops on you. And if one man fails, the whole team fails. So you are likely to be carried through if your body fails by teammates. And that unfortunately is what happened to Devon. Carrying sickle cell trait, his body failed. His coaching told him, your body is amazing, you'll pass out before you die. And he passed out multiple times and did die on February 26, 2001. And as we approach the 20th anniversary of missing Devon Darling, we are not deterred, we are determined to save lives, to educate those coaches, educate those trainers, educate the young athletes themselves, the parents, to number one, know that it is not true. Sickle cell trait is symptomatic and it can have adverse health effects. There's just a few precautions to take. And that is why the As One Foundation exists, because we at least want to make sure that Devon's death was not in vain and certainly want to save future lives. Today on Warrior Talk Tuesday, an important message that's out there in the community is one of transition. What needs to happen, what is happening, what is not happening, where are the gaps when it comes to transition, because this is a huge issue in the sickle cell community, but as we discussed last week, it's also one for the trait community, really needing to educate those young people and transition them from being under pediatric care to, adult care. So with that said, I'm super excited because we have a best practice today. That example that's just doing it right, great to follow. They've made the mistakes for us so we can just follow their example. That's who we have talking with us today. So I will stop speaking and allow my guests to introduce themselves. Please take it away.
Well, thank you so much. And thank you so much for having me. and for doing this. This is a much needed effort in the sickle cell community. So thank you so much. Um, my name is Yvonne Carroll. I'm the Director of Patient Services at St. Jude Children's Research Hospital, and I've been there since 1999. And St. Jude takes care of about 900 children with sickle cell disease. We are a research hospital, and as most people think of St. Jude, they think about cancer, but actually, St. Jude's first grant went for sickle cell disease. So they have been at the forefront. And I tell people in this movement, especially like in Black Lives Matter, you think about what Danny Thomas did.
Mm.
It was segregated. The hotels were segregated. The hospitals were segregated. And was said, we will take everybody. And not only that, he also said that we will not allow anybody to go to any hotel if they don't accept all of our patients. So he helped desegregate the hotels. And I'll just throw one more tidbit. The
Sure.
first building at St. Jude that was built was designed by a Black architect from California, Paul Williams.
Wow.
And he was a good friend of Danny Thomas. And so the first building, the design that was built was designed by a Black man. So having said that, that's kind of how St. Jude got into the, one person on the committee was Dr. Lemuel Diggs, and his professional interest was sickle cell disease. And so the first grant from St. Jude that was given to St. Jude went for sickle cell disease because of him. And so we take care of everybody in as a good neighbor policy,
Mm.
everybody that's in our catchment area.
Mm.
And as you can imagine, being in the South, we have quite a bit of African Americans. Why we have 900 people with sickle cell disease. So I've been in the space over 25 years. Before I came to St. Jude, I worked in the emergency department, a pediatric emergency department. At that time, it was the only pediatric hospital in Memphis, Tennessee.
Mm.
So you can imagine, we're talking early 90s. So it was before most people were taking penicillin. You
Mm.
didn't have hydroxyurea. You didn't have stroke preventive medicine. So you can imagine what type of things uh, that we're seeing in the pediatric
Mhm.
emergency department with sickle cell. And so that's how I became friends with the hematology group. And that's how my interest in sickle cell grew. And that's how I ended up at St. Jude in 99.
So I just have to just say, I think I heard you say that you've been there for 25 years. So that must mean you're like 28 or okay, 29. I mean, you just look so pretty.
Well, thank you. But I have to be a little bit older than, because my boys are 42 and 44. So I have to be a little bit older than that.
Wow, my goodness.
Thank
Good
you.
genes, great genes, great genes.
Yeah.
I'll
Actually,
let
nursing was my second career,
Okay,
actually. So,
okay,
uh,
okay. Well,
but
life has done you well, I
well,
have to
thank
say.
you.
I want to also let you know that we have Ferran Dozier who says hello, Tiana, who we both love.
Uh,
She says,
so,
I love you.
oh, well, thank you. Tell
Um,
everyone I said hello. This is really exciting for me to talk about transition, because one of the things that people don't think about transition, but it begins at birth. It begins with the parents. It's an emotional issue more than anything else. And I tell people, you can't start preparing for transition when children are teenagers. That's like saying, I'm going to start preparing you for life as, when you are an adult. You have
mhm,
to start, you prepare people all the way through, childhood, and you start with the parents, and you emphasize to them that their child is going to live a full life. And so you're preparing them to live a full life.
yeah,
And you start with teaching them, then you transition to teaching the child, and then the teen is you give them skills, that the same type of skills that you would teach them if they were going, well, as they go to adulthood. Because let's face it, all pediatric institutions spoil kids.
Mm.
I mean, we do
Yeah.
everything for them.
Yeah.
So when they become 18, they don't know how to make doctor's appointments. They don't know how to choose insurances. They don't know what a copay is. They don't know what preferred, if you need a referral. They don't know if, they don't even know, like if you're on Medicaid, does it end? Most Medicaids ends depending on state at 18 and 19 years
Mm.
old.
Mm.
Or if you're on your parents' insurance, how long can you stay on your
Mm.
parents' insurance?
Mm.
If you're going to college, can you get medical insurance through your college? So these are things that have to be taught. And they're not things that we necessarily think about. How to fill a prescription. Is it the right prescription? Is it the right dosage? How do I get a refill? Do I have to pay for it? What information do I need? So all of these things are things that that we try to incorporate into our transition program. And you incorporate it over time. It's like I said, it's not something you can teach in one time. How to fill out that dreaded medical form. When you go to adult and they had that 5-page medical
Yeah.
form, have
Yeah.
you
Yeah.
ever had anything in the world? I mean,
Yes.
most children have no clue as to how to fill that out. So we start at 15, giving them one of those and helping, not that they have to memorize everything, but know where to get the information.
So
Most, go
can
ahead,
we
I'm
go back?
sorry.
No, it's
I can
okay.
talk forever.
This is really good. And I'm just going to approach this from someone, because I really need people to think about this. I have nephews that have gone to college or in college. And it was pretty jarring when you send your baby, your nephew, your niece, or whatever to college, and nobody at the university will talk to the parent. They only want to talk with the kid. This is, we're going to teach them how to be an adult, and no transition there, of course.
Yeah.
And all of a sudden, this 18-year-old that I have dealt with and whatever is now supposed to understand all that they're supposed to understand. So that's sort of a general example of what I imagine transition could be when you add sickle cell in the mix. So you said you hand them that form at 15. Do you do anything prior to 15? And let everyone know that we are talking about the St. Jude. Is it the step?
So the E-STEP program
Okay, E-step.
is
Okay.
is a program that we developed because, as again, we start at birth. So we have a transition policy, and we had a plan of care that goes from birth to actually 25, because we have a transition clinic with the adult hospital. And we have themes for each visit, and we make sure everybody is on the same page. So we might be teaching about the spleen one visit, or
Mm.
pain the next visit, or hydroxyurea, but everyone is on the same page. Uh, so we want to make sure that they get this information. So as part of that, we developed the E-STEP program. And that's a program as to help make children independent. You go online, you do it on your own, and your parents can, do it if they want. But we bribe them. We say, hey, you you fill it out. There's a pre and post test. You bring back your certificate where you got 80% or above, and we'll give you a treat. We'll give you, you can pick, they still like toys.
Uh-huh.
Pick out a toy. And so, but it's a lot of information, and it's just reinforcement. You don't have enough time in the doctor's office to give all of the information. I can't give all of the information in, 10, 15 minutes doctor visit, with time that everybody has. So this is something they can do, they can go through on their own. And if they have questions, they can call us, or they can come back when they come back to clinic and ask us. But one of the things that is 6 different modules, and they cover complications of sickle cell disease, nutrition, exercise, basic pathophysiology. But one of the things that is a module that I really like is the
Mm.
genetic counseling, because most of the counseling is not done for people with sickle cell disease.
Mm.
Most of it, you hear 1 in 4. That's for people with sickle cell trait who, happen to have a child with someone else with sickle cell trait. That is not for someone with sickle cell disease. And so they need to know their risk of having a child with sickle cell disease. And you know, we tell people, because who do they interact with? Other people with sickle cell disease, oftentimes. And I've known several couples who have married and both had sickle cell disease. And you have to understand that if you have a child, that's 100% chance.
Yeah.
I mean, 100% your child is going to have sickle cell disease. That should not be a surprise. So we try to teach that information prior to any, any surprises that they might have.
So I heard based on what you're saying, I have two questions. The first is when when you are doing the genetic counseling or any of the modules, how involved I mean, were there young people involved with establishing the modules? And how successful, how how received is it, well received?
So we always have our population involved. We have focus groups with our teens. They helped with, matter of fact, some of our teens are in the video. Well, their voices are.
Sure, sure.
But we always, beta test with them. But
Mm,
even in the development, it's like, what do you want? We do quick surveys in clinic. What do you want to know about? What would you like to, more information? And the same with our healthcare providers. What do you think that that should be included?
mhm.
So, and we always beta test, and then we reassess and make changes on the beta test from our teens. And our young teens and young adults are surprisingly engaged.
Good,
Like I
good.
said, we bribe them, but the thing is, we've known them since birth.
Yeah.
So by the time they're teenagers, there's a rapport there, and they our population is really involved and really they're really good with doing things that maybe necessarily they wouldn't otherwise do.
So, I going back, you can you tell us a little bit how you, because at this point I'm usually curious about your sickle cell story, whether if you choose to disclose your sickle cell status or not. How was it that you came to the sickle cell community?
So my first job well, again, as I said, I started with probably seeing the worst of the worst um, in the emergency department. When you see a child that's septic, I mean, that's just something you never ever forget. When you see a 3-year-old that has a stroke, um, when you know, when you see these things, you just never forget them. So when I went to St. Jude, my first job was telling parents that their child had sickle cell disease.
Mm,
And because when you're in the hospital, your child gets tested, your newborn gets tested, but you go home before you get the results. So you don't know that your child has sickle cell disease. So you think you have this perfect child that you've been planning for 9 months, and then you get a cold call from someone that says your child has a chronic life altering disease. And so I did that for 5 years, and I used to do home visits because I wouldn't have wanted to get that
call.
just by a phone call.
Yeah,
And so
yeah.
I would make the phone call, but then I would offer to come to their home and talk to them. And every every everybody wanted me to come to their home. And so we had about 50 children a year, newborns a year. And I did that for 5 years. Well, you get to know the parents, you get to know the grandparents, the aunts, the uncles,
Mhm.
and you go through, the emotion with them, because that first visit is just all emotion. It's emotion. That's what it is. And but also, again, that was the time um, before you had stroke prevention.
Mhm.
So you grow to love children, and then they're 5 and 6 years old and they have a stroke.
Mhm.
And this beautiful child who has been so vibrant and running around and playing now is in a wheelchair and can't walk, or has the has the mental capacity of a 7-year-old. I just remember one parent, they were they were feeling guilty because they said we should have known, like her schoolwork was going down, and we should have known something was wrong. And they blamed themselves when their child had a stroke. So, you go through all those emotions, and I tell people to this day, they should not make little caskets. I mean, that is the most gut-wrenching thing in the world. And, you know, I'm I'm so happy to say that now most children live to 18
Mm.
years old. But when I got in it, they didn't. And so so that's my story with how I got involved. And that's when I started wanting to be more involved and get into education and give everything that we had away. That's our mission at St. Jude, to give it away. And that's what I tried to do. Take it as far as I can and give as much information as I can.
I just want to remind you or let you know, Indira Mary, she says hello. And, Tiana says she is preaching. Yes, you are. And I already asked you this question off air, but I understand that you are what we at the As One Foundation call a sickle cell ally. That is a term that we reserve for those of us such as myself, that are proud and loud AA warriors. We have none of the abnormal trait or hemoglobin, but all of the love, all of
Oh,
the passion, all of the desire to see this community win, and particularly with education. So, with our theme this month being transition, we have uh, sought to balance and give some attention to both the sickle cell and sickle cell trait side of the house, if you will. Last week, we talked about um, there's a significant lack of transition when it comes to the trait warriors because again, there's just a lot of information gaps there, and people not realizing that it is not factual that sickle cell is asymptomatic.
yeah.
um, the
Ab-
those young people that may be dealing with cramps or growing pains are likely experiencing some crisis pain. And as we know, this stuff does not happen and then go away and then your muscles and vessels go back to normal. That's damage upon damage upon damage, and that can happen in someone with just trait. So
And you're right. And one of the things that we do is parents, of course, are at risk for other children having trait as well. If they have a child with disease, then probably they have children with trait. And one of the things we do, we offer the test to siblings as well. And that educational piece is I talked to one young man, and he was like, and he was a parent, and he said, I like to go running up in the mountains, and sometimes I get so out of breath, and I'm like, oh, wait a minute, let's talk
yeah.
about this,
Hmm.
because
Hmm.
no one had given him the education. I'm like, you're up there by yourself, and if you pass out, there's no help. And you never think about those things, but you're right.
Hmm.
No one gives people with trait. With sickle cell trait education. One of the projects that we did testing over several years in the community and we tested 5,000 people in the African American community in the Memphis metropolitan area. And, we counseled everyone that we found that had trait. We counseled them on their trait status. We
Hmm.
have one person whose sole job because we get trait as well as disease. But actually, we have two people now, and their sole job
Wonderful.
is to counsel people with sickle cell trait that we receive from the state, because there's so many, and most of them don't even know when you talk about that transition. One of the critical things is they have no idea that they even have trait, and
Yeah.
so that's huge.
Yeah.
Just knowing your status.
Just knowing your status, getting tested. And, as much as that, what is it, sickle dex is, it is a yes or no and possibly a false positive or negative. That electrophoresis will give you the real story, give you
Yeah.
your percentage and all of that. So with St. Jude, I'm thinking, okay, this is nirvana. This is just the perfect place. What, do you have people that just move to your city because they, or I mean, how is that working? Or, are people recruited nationally to come to, or do they seek you out? How does a person get to take advantage of the services at St. Jude?
So St. Jude really is a research hospital. That's how we started. And so
Okay.
we don't take people unless we have a research study that because we know we have limited resources, and we feel that we can make more of an impact if we research and give away that research.
Mm.
So we only take people that have that are have can are eligible for any research studies that we have. So because we have 900 children with sickle cell disease, obviously we don't need anybody from outside of the area because we have so many people available. But we do for our transplant and our gene therapy. Uh, we take people outside of the area, and but again, most of the time we have such a large population that and over 80% of our population uh, volunteers for research projects. So
Mm.
and yes, I can't. We have had people move to Memphis
Yeah,
uh,
I would
because they want to
imagine.
come to St. Jude. But the bottom line is most people can't just uproot and change where they
Sure,
live.
sure.
Um,
How has COVID affected you? Are you doing any of this transition online now? Have you bolstered your virtual offerings?
so it's funny you ask. We have a transition tour where we take the young adults and teens to. We have 2 adult comprehensive sickle cell centers, and we would physically take them to the centers and let them meet the doctors and tour the facility and the staff. Well, now we do that virtually.
Okay.
Uh, so we have one this week, as a matter of fact, and hands-on is much better. But we have a couple of teens that, well, not teens, young adults who talk about their transition experience. And one of the things that I have to say that's always gets me, no matter how many times I hear it, is the young adults say they didn't plan for a life because they thought they were going to die.
Mm.
And so they said, what's the use in planning? I mean, I remember specifically one said that they had a sibling that died at 28 and they didn't think they were going to live beyond 28. So they made no plans. So when they got to 28 and were alive, they were like, okay, well, what do I do now? So I think that that's with all the treatments and all the therapies now, that's something that we really have to make sure that hits home. That there are people living in their 80s now with sickle
Yeah.
cell disease.
That
So
is
we
pretty, yeah, that's pretty impactful to hear, um, planning for life because you didn't think you would live. That's really, that hits home.
yeah.
That's pretty touching. So, with the virtual tour, though, is that still just reserved for Memphis residents, or is that out? Is that available beyond your walls?
So the virtual tour is for Memphis because it's Memphis Comprehensive Facilities. But our e-step is online. Anybody can use it.
Wonderful.
And it's www.stjude.org/sickle cell.
I'm putting that in
And
the thing. Saint
and
Jude.
STJUDE
Okay.
.org
Uh-huh.
/sickle cell, one word.
Okay.
And on that is also all of our educational material. And one of our books is a transition book that talks about the steps that I talked about, most of the things that people need to know when they transition from pediatric to adult care.
Wonderful. So this is available to
To
anyone.
anybody.
Perfect. 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 Because we know Memphis is heaven, but we need we need, these people, parents, young people, family members to be able to engage here because you will live. Warriors are living longer, they're thriving and doing some amazing things. My sickle siblings, as I call them, I am just fans. I am just they are starting, like Tiana. Tiana is a rock star.
I know.
I am
I
just a
know.
fan
So
girl.
proud of her.
Yes. Yes. And what they go through, just the pain. And I have trapped the pain descriptions in my head, and I use it as motivation to dig deeper, to find more and more resources, um, because so my wheelhouse is trade. That's what my research is in. But I know that any person who biologically births a child with disease, a person with a disease warrior births a child, that child is 100% going to at least have trade.
Absolutely.
So, we choose to balance. We choose to be inclusive of both in the conversation.
Yeah.
And so the family issues, even when you're dealing with the family planning advising, parents are within their rights to choose whatever path they want, but at least they'll be armed with good information, because I am heartbroken when I hear parents say, I didn't know. And
Yeah.
then they'll go further to say, had I known, I would have made a different decision. So the goal is just have informed people making informed decisions. And
Absolutely. I
let
agree.
that be the thing. I thought I saw another comment coming in, but with that, we are right at our time. So I'd like to give you the last words as I say thank you to you, Ms. Carol, for all that you're doing, all that you are. You are a jewel in this community, and I consider you a sibling as well, a sickle cell ally sibling, because you don't have to have sickle cell in your blood to care. And I don't understand it sometimes, but it's in me. The fire burns, and I intend, to give it all away. I really intend to uncover every rock until this entire world is informed about this global condition. No, everybody needs to know what it is, understand what it is, and then find what you can do about it and do it. So I'll
Absolutely.
surrender the last words and just invite everyone to join us here next week for Warrior Talk Tuesday. You have the last word.
Thank you. So, as last word, I can't leave without. I'm also a board member of the International Association of Sickle Cell Nurses and Professional Associates, ISCNAPA. So, we're having a conference free to all, April 14th and 15th. And I'll give you the information. Anybody can come and register at www.ia. I have to write it down. ISCNAPA. IASCNAPA, and I'll send it to you, .org.
Okay, I'm just gonna put it in right now. So www.
www.IASCNAPA.org.
Okay. And the information is there for the
The
conference, April
information is there for
13th,
the
14th.
conference, 14th, 15th.
Okay, 14th,
Next day,
15th.
14th, 15th of April. So, it's going to be it, and it's geared towards non-physicians. So people told me, I go to these conferences, sometimes it's so high level, I don't understand anything. So this should be a good one to ask questions, and that's not on such a high level. So,
Good. I love that. Love that. Love that. Okay. So thank you. Thank you.
thank
Thank
you.
you.
And you take
Every
care.
absolutely, you as well. And we look forward to answering any additional questions or comments. But that link is up there in the comments right now. We will see you all next week. Thank
All
you.
right. And stay safe, everyone.
Absolutely.
Bye-bye.